My name is Rebecca Hancock, and this presentation will discuss why it's essential that health professionals develop skills to successfully work as part of a group. We're going to look at the definition of a group and the phases through which a group actually evolves, and we'll also explore some group dynamics, potential issues that may arise along the way, along with strategies and skill sets that enable a group to function successfully. Finally, we'll also look at teamwork in the context of healthcare and some examples that health professionals may work in practice. So let's consider what a group actually is. So Hagar defines a group as a social unit made up of two or more people who interact. She goes on to describe a team as a group of individuals responsible for the accomplishment of team goals, where members bring to the team a wide range of skills and experiences that are required to accomplish identifiable team goals. So a group can develop and evolve. It actually must move through different stages. The theorists Tuckman and Jensen actually described 5 stages. So the first is the forming stage, where initially members build a sense of trust by making introductions, building the group structure and defining goals. The second stage is the storming stage, which builds a sense of commitment. There are some discussions and interactions to develop group roles, and they usually follow some confrontation, perhaps because there's some resistance to tasks. The third stage is the norming stage, and this builds a sense of purpose. So the limits, rules and expectations are set here. The fourth stage is the performing stage, and this builds a sense of hope. The group focus becomes more progress and task-based because this is when the group becomes productive. The last stage is the morning stage, and this builds a sense of accomplishment. The team can evaluate their goals, transfer knowledge before working up the group. So a group can be organised. Each member will consciously or unconsciously have a role. Now, a role is an expected behaviour pattern that's attributed to someone occupying a position. So a functioning group will always have a leader, and there are various other roles that can be played out by one or more people in the group. So a leader is an individual, and they have the ability to influence the group towards the achievement of the goal. So they need to be aware of what the goal actually is, and they need to be committed to achieving it by inspiring, motivating and directing the group. Now, as for the rest of the functional roles, the theorists Ben and Sheets actually define 26 functional roles. Now these are categorised into task, personal and then dysfunctional roles, and we'll have a chat about those now. So task roles relate to getting the work done. Some examples include contributors. Now these people initiate discussion and so that they can make sure that the approach suits a group goal. Opinion seekers, now they get different perspectives from the group. Evaluators, who consider ideas against different standards. And recorders, who they act as the minute keeper to make sure that the group stays on track. Okay, so personal roles, these contribute to the positive functioning of the group. Examples include an encourager who is warm and praises the efforts of the group members. Harmonisers, who try to conciliate and reduce tension. Compromisers, they generally try to change their position for the better good of the group. Observers, they provide feedback to the group about how it's functioning. The last type of functional roles are dysfunctional roles, which disrupt the group progress. Now, examples include blockers, who oppose ideas but don't offer any suggestions. Self-confessors, who disclose personal feelings because they think it's relevant. Disruptors, who distract other people to avoid work. And dominators, who try and control the conversation and dictate what the group's doing. Okay, so because of the different people in the group and the stages at which the group actually grows, conflict is quite common and is expected. So ideally this should actually lead to the discussion of the matter, the issue that needs to be resolved, and result in an agreement about the best course of action for the group. But sometimes it can be dysfunctional, and the group may not be able to work together until the issue has been managed. It usually arises because of lack of effective communication, lack of understanding of others, and lack of mutual trust. Now, according to the Conflict Resolution Network, they actually suggest some strategies to prevent or resolve conflict. So this might be through practicing effective communication techniques, developing understanding of team members, so their skills, their scope of practice and their experience, because this actually helps to relinquish some control and encourages trust. It's also really important to be flexible and willing to resolve issues through negotiation, conciliation and mediation. Being appropriately assertive is also really important. So that's your ability to objectively state your case without making other people really defensive. And lastly, managing your emotions is really important. So people act for a certain reason. So they might be aggressive because they are wanting to protect themselves. So it's really important to respond understanding the reason for the disruptive behaviour. Okay, so why do we work in teams? Well, the Nursing and Midwifery Board of Australia actually guides nursing practice, and it makes collaboration a prerequisite for health professionals and nurses who are expected to work as part of a team. So teamwork also has a range of other benefits. So it improves health professionals' ability to provide better quality, more efficient care. So teams make fewer errors, and there's a cohesive use of resources. It reduces workload and professional fatigue. It also improves patient satisfaction because of the better health outcomes that are achieved. And the health professionals also benefit because they work with people from different areas, and they can learn and pass on new knowledge. Okay, so there are different types of health profession. There are different types of groups in the health profession. The health profession is a diverse group of people, including doctors from different disciplines, so paediatricians, surgeons, etc. Nurses and other healthcare providers such as physiotherapists, occupational therapists and speech therapists. This actually reflects the medical advances and the complexities of modern patient care, and because of this there's actually been a shift away from individual practice towards health teams. So a health team comprises of practitioners who work together towards a health goal basically, and according to Higgs, health professionals will most likely work in 3 types of groups which all function differently. So there's multidisciplinary groups where health professionals all come together, but they approach the client from their own perspectives. So there will usually be separate individual consultations. Interdisciplinary teams, again, health professionals all come together, but they're more integrated in their approach. So there might be a group of people that all attend on the patient at once. And then the transdisciplinary teams, now again, health professionals all come together, but their boundaries are a little bit more blurred because they actually share some functions. So an example might be a general practitioner being the main care provider, and he actually refers to others and other specialties as required. Okay, so examples of groups in the health services include professional groups. So these are normally focused on professional issues, so the Nursing and Midwifery Board of Australia. Work-based groups, these are task-orientated, so it might be a nursing department. Educational groups, now these are teaching-focused, so health promotional groups. And lastly, therapeutic groups, now these are focused on treating the patient, so cognitive behavioural therapy groups for depressed patients. Okay, so to work well together, there are various skills that are really important for a team member. So firstly, it's effective communication techniques. So using clear language and communicative behaviours that need to adapt to the different team dynamics. Working in a collaborative, coordinated way. So you actually need to hand over some control for the shared decisions to be made. You need to pursue common goals, obviously keeping the patient's best interests in mind. You need to behave respectfully and in a professional manner. This is an ethical requirement, but it's also really important for effective working in groups. Reflection is also really important, so actively take the time to think back about decisions and experiences so you can learn and develop. It's also really important to practice empathy so people feel that they are understood, and this may lead to new understandings on your part as well. Okay, so in conclusion, teams need to move through a life cycle to grow and become effective. Different team members contribute different strengths, knowledge and experience, so the relationships will inevitably be unequal, and these factors may contribute to conflict which needs to be overcome for the group to function successfully. The health profession overall can no longer function in isolation, and professional standards actually mandate teamwork to achieve best practice and better health outcomes. Whilst there's considerable variety of teams in the health services, teamwork always requires a professional commitment to effective communication and respect for one another's roles and expertise. And this is the responsibility of all health professionals whose overarching goal is to promote the patient's best interests. Thank you.